Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Ondo to take vaccination drive to religious centres and other public gatherings. Australia's Melbourne reports record COVID cases despite 2 months of lockdown. The country's COVID-19 death toll rose to 2,701 on Wednesday after 6 more people battling the disease lost the fight. The Nigeria Centre for Disease Control (NCDC) confirmed this last night while giving an update on the outbreak. 437 more cases were recorded in the last 24 hours in 17 states and the Federal Capital Territory, the FCT, with Lagos recording the highest number of infections. Here's more on the update.
437 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the NCDC, the latest figures were reported from 17 states and the FCT, an increase from the figures reported earlier. 44 cases were recorded in Kwara, 37 in the FCT, Edo had 32, Kaduna 30, while Anambra and Delta had 22 cases each. Osun registered 12 cases, Benue logged 7 cases, Abia and Nasarawa had 6 cases each, while Kano had 5. Other states that reported a single-digit infection include Ekiti, Plateau, Bayelsa, Ogun, and Oyo states. There were backlogs of 126 cases reported from Lagos and the 22 cases from Anambra for September 28th and 29th. The overall count of confirmed cases in Nigeria now stands at 205,484. 222 people have been discharged in the last 24 hours, increasing the total number of recoveries to 193,482. Lagos is still leading the chart of states with the highest number of cases currently on admission, followed by the FCT, Delta, Edo, and Oyo states. 6 additional deaths from COVID-19 complications were reported in the last 24 hours, raising the fatality toll to 2,701. Presently, there are more than 9,000 active cases in Nigeria, while over 3 million samples have been tested so far. Over 4.7 million eligible Nigerians targeted for COVID-19 vaccination have been reached with the first dose, while over 1.9 million persons have been fully vaccinated so far. In Africa, there are more than 8.3 million confirmed cases and over 211,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 233 million, while deaths are beyond 4.7 million.
The Presidential Steering Committee on COVID-19 is reminding Nigerians of the safety guidelines for travelers arriving in the country. In its revised travel guidelines ahead of boarding, passengers must perform a PCR test not more than 3 days before boarding. RDTs, that is the rapid diagnostic tests, are not acceptable. For passengers with multiple connections before arrival in Nigeria, the PCR test must be valid within 72 hours of boarding from the first point of departure. The second step is that all intending passengers, including diplomats and children less than 10 years old, must register via the online national travel portal with all information correct and verifiable. And after filling the online self-reporting form, passengers are directed to upload the negative COVID-19 PCR test onto the portal. Of course, only children less than 10 years are exempted. Now, following successful payment, passengers would download the permit to travel certificate or QR code, and this is visible at the top right corner of the portal. Now, airlines that board passengers without any of the 2 documents, a negative COVID-19 PCR test done not more than 72 hours prior to boarding, and a permit to travel certificate, the QR code, shall be sanctioned. All passengers arriving in the country are required to go through the routine port health screening, present the electronic printout evidence pre-boarding, present their international passport for clearance, and proceed on the mandatory 7-day self-isolation quarantine in their selected in-country destination. There's a lot more information on the Presidential Steering Committee travel guidelines, and you can find that on their website. Meanwhile, the Nigerian Civil Aviation Authority, NCAA, has refuted a report by some local tabloids and social media that the federal government, through the regulatory agency, directed that from the 1st of December 2021, travellers without proof of vaccination would not be permitted to board both local and international flights. In a press statement issued by the NCAA, it reads in part, "We want to state categorically that no such directive emanated from the federal government through the NCAA. Therefore, the authority is calling on the public to discountenance such news as there is no iota of truth in it." The aviation regulator adds that it will continue to support all the federal government initiatives to curb the spread of the Delta variant. And as part of strategies put in place to improve the level of COVID-19 vaccination in Ondo State, teams of health workers are to be dispatched to religious centres, markets and other public gatherings to vaccinate people. Our correspondent captures the story.
Ondo State residents turn up at the head office of the state's primary healthcare development agency, Akure, to receive either the first or second dose of the AstraZeneca or Moderna brands of vaccine. Residents claim that the exercise was on course. However, data capture and other hitches have slowed down the process. The Director of Disease Control and Immunization at the State Primary Healthcare Development Agency commends the turnout of health workers and residents alike during the second phase of the exercise.
They will be moving up and down in 5 sevens, and it's not that they will be moving from house to house anyway, but they move to where people gather, like in the marketplaces. We identify churches, mosques, playground, and some other areas. Where we have a large number of people and we can vaccinate them, like that. Have our identified health centers in all the 18 local governments area, not only Riverine, even in the core, Akoko areas or Owo, Ondo West, Ileluji. The 18 local governments will have our various centers there. And we have our health workers that have been trained for the purpose of giving this vaccination without having any problem.
Some of the persons vaccinated share their experiences.
It's a little painful, but not that much. It's just like a normal vaccine.
Good that is out. They were supposed to come out for the immunization. It's very good. When they are coming, they should eat. They should eat their food before they come and take the vaccine.
We don't know the side effects, but we need to take it just for protection, because we don't know whether it even works or not. But still, we just take the risk. You never can tell. But it's better to take it than not to take it and then risk having COVID-19.
Even with an increasing vaccination pace, the Nigeria Center for Disease Control advises adherence to public health measures for effective pandemic response.
And for more on the coronavirus situation in Ondo State and also vaccination that is ongoing, joining us is Dr. Francis Akabiemo. He is the Permanent Secretary of the State's Primary Healthcare Development Agency. He joins us virtually now. Thank you for joining us on the program.
You are welcome.
All right. I'd like to get an idea of how receptive residents are to the rollout of the COVID-19 vaccines.
Thank you so much. The uptake has been fantastic. It has been huge. And the turnout has been most impressive compared to even the first phase. If you move around the health center, even at our head office here, by 8 o'clock, we already gathered, lined up to receive the vaccine. So I think it's the political will of the governor who actually made that pronouncement that it is mandated that people should take the vaccination. I think that is why we are having this option. Because even the vaccine that was given to us, it did not take up to 2 weeks before we exhausted it. Just about 3 weeks, sorry. And we have to call the national to send us, and immediately they send us additional doses. And this evening again, I've already sent a mail again to them that what we have now is already at the level of complete exhaustion, that we need additional supply. The email have just been sent. So that is to confirm the high level of utilization of the current phase of vaccination for COVID-19.
So if one were to ask the biggest challenge you've had since the rollout began, what would you say it is?
Well, the biggest challenge initially was even the control of crowds, because the crowd was more than what we actually anticipated. That has been the major challenge. That's all, because in terms of political support, release of funds to move vaccine and to store it, we don't have challenges. I think for this exercise, the government have released huge amount for us to ensure that we have a 24 hours supply of electricity. So those are the challenge we will have had if it was time of challenges. But we don't have challenges. Challenge now is as how to control crowd and to ensure that we don't run short of vaccine. Though we still have quantity now, but because we don't want a situation where somebody will come next week and will say there's no vaccine, that is why we quickly have to send a message to them at the national that we are expecting additional supply. This is the second request.
So one can also deduce that perhaps there will be no need for a vaccine mandate in Ondo State.
I think the mandate the government have given is already, that is what I'm saying, is pushing it. I know there is this bandwagon effect. If civil servants are doing something, civil servants have wives, they have cousins, they have families. You know, at level of civil servants, it's easier to enforce. But all the civil servants, most of them are living within the community. So I think also we are seeing now is also the part of the people who are following governor's directive. And because the directive was not meant for civil servants alone, but of course, it is easier to enforce it at the level of civil service. But these civil servants, they have wives who are not civil servants. They have a husband who are not civil servants. They have uncles, they have relations. So I think what we're having in Ondo State is, if we continue like this, we may likely achieve herd immunity in no distant time.
What furthermore can you tell us about health workers, if they've all been vaccinated?
Well, I cannot really say that all have been vaccinated, because there's no perfect system in the world. Because during the first phase, the doses that we actually estimated for the health workers, we exhausted it. Of course, there are what is called one or two, how will I call it, myths. You know, some people might come in even though they may not be traditionally health worker. A health worker can come with the wife to take vaccine. But based on what we had then, we had the 97% coverage, both health workers and non-health workers in the first phase. That means that majority of our health workers have been vaccinated. And the second phase, those remnants will have come, because we are people coming now for the second doses, and it is only few health workers that are coming for first dose. That means at the first phase, most health workers have actually been vaccinated, because at the first phase we have a lot of health workers, but now we are not seeing the number of health workers as much as it was in the first phase. That is to show that during the first phase, majority of our health workers were vaccinated.
Appreciate your time. I guess the next thing is to wait until indeed more vaccines are rolled out to the state. We appreciate your time on the program. Dr. Francis Akabiamu, Permanent Secretary, the state's Primary Healthcare Development Agency, Ondo. Thank you for joining us on the program.
You are welcome.
Well, still to come, WHO says that over 70% of African states missed the COVID jabs target. We have that and more when we return. Welcome back. The World Health Organization says only 14 out of Africa's 54 countries have met the global target of vaccinating more than 10% of their populations against coronavirus by the end of September. That's largely because COVAX, the mechanism set up to distribute vaccine doses to poor nations, have not been able to get enough doses. Seychelles, Mauritius, and Morocco have achieved the highest vaccination rates, all above 40%. The WHO attributes this to their robust vaccination programs, as well as the size of the countries and their populations. Others which have met the target are Tunisia, Eswatini, Cape Verde, Botswana, Comoros, Zimbabwe, Equatorial Guinea, South Africa, Mauritania, Lesotho and Rwanda. But overall, just 4% of Africans have been fully jabbed compared to 60% in the European Union. COVAX had planned to deliver nearly 300 million doses to Africa, but it's only been able to procure 72 million doses after the rich nations bought up much of the stock. Away from Africa to school children who are close contacts of COVID-19 cases would no longer have to self-isolate if they showed no symptoms. With the testing system coming under extreme pressure as 14,000 children have been deemed close contacts of cases in Ireland, public health specialists are pressing for a relaxation of rules that require them to stay home for at least 10 days. The change would apply to asymptomatic children who are not vaccinated. Dr. Monica Perez-Oike is a general practitioner in Cork, Ireland, and she joins us now. Welcome to the program. Dr. Oike, if you can hear me, first tell us about these new rules for children. Monica, you might need to unmute.
Can you hear?
We're going to try. Yes,
Oh,
indeed.
I'm confused. My apologies.
No worries, no worries. So tell us about the new rules, isolation guidelines for children.
Okay, so yes, I think it's fantastic because the last 18 months, the children have been affected and it's just made them more grown up than they should be. So the new rules now, if children have no symptoms, basically they shouldn't isolate. So any child that even has, any child that is even in the home of anyone that had COVID, they don't need to isolate if they don't have symptoms, and especially if they've gotten a negative COVID test. So I think it's great because then they can get back to school and do what they need to do and be kids again.
So in terms of maybe parents, guardians, or even schools and those who are managing schools, how are they reacting to it?
I think it's a mixed reaction. Some people are for it, while some people are not. Let's not forget, Ireland is actually doing very well when it comes to the COVID vaccinations. We have, I think, about over 91% of our adult population vaccinated. So that is fantastic. So I think it's just the little sacrifice we need to do for the children.
So vaccination taking place is quite fast, but how also easy is it getting, at that very young age, getting them to understand what COVID is, what social, physical distance is amongst themselves, amongst all the other safety protocols?
Yes, unfortunately, I think they all know the buzzwords, but you need to wear your mask and you need to keep a distance. But I think only a very few amount of kids do understand. They know COVID is a bad virus that's taken over the entire world, and everyone just wants to get back to normal. I think now the next thing everyone is looking forward to is Christmas and what Santa is going to wear, and is Santa going to wear a mask? So that's the question they're asking.
And that's also another thing. For example, the UK is working at winter plans. What could happen? Plan 1, Plan B, A, B, C. Is Ireland thinking of anything, the days ahead getting colder?
Yes, so in October, I think October 20th, we're thinking of easing the restrictions to basically next to nothing when it comes to mask wearing and also places being closed. So that's one thing. And another thing in protecting the population now, so it's influenza season. So the flu vaccine protocol vaccinations have started, and also the COVID booster vaccines as well. But right now, we're only vaccinating over 80s because the evidence shows that they are the ones that do need a third dose at the moment. So that's our plan for the moment.
Finally, Monica, what is Ireland's view on booster vaccines to curb COVID-19? There's been so many arguments, the government's taking different positions on that.
Yes, so what I love about this country, we do take our time. So now we're focused on the over 80s. So dependent on what happens in a couple of months now, probably the age bracket is going to go down. But for now, we're sticking that the COVID booster vaccines are now for over 80s because the evidence so far shows that they are the one that needs it at the moment.
All right, we appreciate your time. You look lovely, by the way, did I mention? Thank you so much, Dr. Monica Price.
Oh,
General
thank you.
Practitioner Island. Thanks. Have a lovely,
Bye.
enjoy your evening. Bye. And the UK government says 48.8 million people have been vaccinated in the UK, at least receiving their first jab, while nearly 5,000 less the number have received both jabs. This comes as the government statistics show another 36,480 cases of the infection have been recently recorded. We'll hear more on the situation in other parts of the world in our global update.
Global update begins in Australia, where Melbourne's COVID-19 cases have surged to record levels on Thursday. Officials are blaming illegal home gathering for the spike as a hard lockdown to combat the spread of the Delta variant nears 2 months. Authorities in Victoria, home to Melbourne, estimated nearly a third of Thursday's 1,438 new infections could be traced back to the home parties last weekend.
This is the reality that every single Victorian, including the government, faces. If people continue to visit each other in their homes, then they will bring the virus with them. They will spread the virus. And look, I don't think anyone necessarily who makes that choice thinks that they're going to be spreading the virus, but that's the reality of this thing.
Officials admitted Thursday's numbers, a large jump from the 950 cases the day before, is a significant setback in managing the flare-up as they race to vaccinate the state's 5.5 million adult population. The second civil trial and the first of a German tourist opened on Thursday, September the 30th in Vienna, where Austrian authorities stand accused of responding too slowly to the coronavirus outbreak at a ski resort of Isgil in '92. In early 2020, the outbreak at Isgil was Austria's biggest and helped spread the virus across Europe. Hundreds of Austrians were infected and thousands of foreign tourists said they were too, as the virus found a breeding ground in crowded après-ski bars at the resort, a party hotspot that branded itself the Ibiza of the Alps. North Korea disinfected a department store in Pyongyang as part of the state's antivirus measures to prevent coronavirus from spreading. In a video provided by North Korea's official news agency KCNA, employees of the Pontonggang department store were seen disinfecting facilities of grocery and restaurant, and visitors were seen using hand sanitizers at the entrance. North Korea has not reported any coronavirus cases and has imposed strict antivirus measures, including border closures and domestic travel curbs. The World Health Organization, WHO, is a possible contender for the 2021 Nobel Peace Prize Award. The WHO is an agency of the United Nations set up in 1948 to improve health globally. It has more than 7,000 people working in 150 country offices, 6 regional offices, and its Geneva headquarters. Its Director General, currently the Ethiopian Dr. Tedros Ghebreyesus, has been leading the fight against COVID-19 since the pandemic began.
It is crucial to limit the risk of COVID-19 infection among all. Continue to take responsibility. Visit our website for more updates. You can find breaking news and also several other stories, a better understanding of the pandemic. Our top story there, and Nigeria's cases. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.